cold or a cough, it can feel like your body is shutting down. You may have congestion, a blocked nose, you may feel achy in your body, or a tightness or heaviness in the chest, and maybe just lack of energy. In this video, I'm going to share with you a fascia decompression class that all you need is a tightly rolled up towel or the block therapy block, and you can even do this on a bed. So hello, my name is Catherine, and I support people to free themselves from pain so that they can move pain-free every day. So let's get started. So you'll need a tightly rolled up towel. There should be a video on my screen now with a link to show you how to roll up the towel, or you'll need the block therapy block. If you're going to do this on a bed, follow exactly how I do it on the mat. If you're going to do this seated, just add pressure in the area using your hands. So the first position we're going to do is the belly position. So we always start in the belly position to connect to the breath. So roughly around the belly button area, we'll be placing the towel or the rolled up towel in that area here. And if you're sitting down, you just will use your arms for pressure and lean into the block or the towel and breathe in the same as I will guide you as we get into position. So place the towel or the block on the mat and slowly come down. Don't worry about the exact position, so just roughly in that belly button area. Now stay up on the elbows to start off with because we want to ease into position. We don't want to be forcing or rushing the body. And we want to connect to that diaphragmatic breath, and we do that by breathing in through the nose and feeling that belly expand. So we want to feel the breath expand and lift you up from the block or the towel. And then as you exhale, feel that belly going small. Imagine that belly button's touching the back of the spine. We want to make sure that our shoulders and elbows are in alignment. We don't want to be putting any strain on the upper body. So if you can't stay like this, get a support cushion and pillows to support that upper body. If you are feeling comfortable, you can come all the way down. But we don't want to rush the body into areas it's not yet ready to do. Your breath is always your guide. So you want to be breathing in and out through the nose if you can. And if you've got a cold, that might not be possible. So if you do need to breathe in and out through the mouth, then do that because you may have a blocked nose. But whenever that blocked nose is eased, try and do it in and out through the nose where you can. So breathing in for a count of 4, feel that belly expand. Breathing out for a count of 6, feel that belly going small. And we want to stay in this position for a minimum of 3 minutes. You will feel some pain in this position, and that'll be due to undigested food, waste that's not been eliminated, but also inflammation. This is a great position to do in bed or whenever you need to connect to that parasympathetic state, get yourself back into that rest and digest, and it helps you to just relax, release all that tension. When you're ready to move, just place your hands underneath your shoulders and exhale out of position. So the next position we're going to do is the diaphragm. So where we've just done the belly button position, you just want to move it up higher. So tightly roll up that towel because it will have squashed with your body weight and gravity on it. So move from the belly button position just up, so underneath the chest or pec area, and you can add pressure again if you're in a seated position, or we'll come to a lying down position exactly the same. Now the reason we're doing the diaphragm position is that is where the breath should be coming from, and we need to help it. So when we're not feeling very well, we've got coughs and colds, we may start to chest breathe, but we want to strengthen this diaphragm. We want to breathe in through the nose, or if we can, and expand that belly. We want the belly to be expanded, and we want the belly to expand and then breathe it up to the diaphragm. So we want to feel that movement on the block or the towel. So let's get into position. So just place that block or towel on the mat or the bed and slowly come down. So just underneath that chest pec area. Don't worry about exact position, and stay up on your elbows again. So let's connect to the breath. So breathing in through the nose if you can for a count of 4. Feel that belly expand, and then bring that breath all the way up to where the diaphragm is, so that you can feel that breath underneath the towel or the block. And then as you exhale, feel it getting smaller and feel yourself sinking into this area. Now you're on your ribs in this position, so you may feel some pressure or pain, and your breath is always your guide. If you're ever in a position and you can't breathe in a relaxed way, then either go onto a bed if you're on the floor, use the towel if you're using a block, or just put yourself in a position where it's not taking that breath away. So if you can't do the diaphragm position straight away, go back to the belly position. And stay in this position for a minimum of 3 minutes. And when you're ready to move, just place your hands underneath your shoulders and exhale up and out of position. So the next position we're going to do is the sternum. And the sternum is in between the chest, breast area here. So you can do it right in the middle or a little bit higher. So don't worry about the exact area. And this is a great area to open up that chest. So when we've got colds and coughs, we may feel pain in the stomach from coughing, we may feel congested, we may round forward, and we want to open up this area, create space in the area so the lungs have the space that it needs and that the breathing becomes easier for you. So if you're doing this in a seated position, you would just place the towel or the block in this area and add pressure with your hands and lean forward. You can use your legs again to add that pressure. And if you're doing it in a bed or a chair, you just do the same as I'm going to do now. So place that towel or that block on the mat or the bed and slowly lower yourself down and make that small adjustment to be on top of this block or towel. Now look forward once you know you're in position and just connect to that breath again. So breathing in through the nose if you can for a count of 4. So that breath comes from the belly and expands up, and now bring that breath all the way to the sternum. And then breathe out for a count of 6, relaxing the body, sinking into that block or towel. And this, again, you may connect to some pain because there's a lot of pain in this area due to the forward collapse. And if you've got that cold and cough, there'll be a lot of congestion. So we're opening up the body to be able to send that blood and oxygen so that you can breathe easier again. This for me is the best position that I find for when I've got a cough and a cold, to release that congestion, get it out of the body. So when we're breathing, we are breathing, connecting to the pain and breathing that pain out of the body. And stay in this position for a minimum of 3 minutes. And when you're ready, slowly, because you will have sunk into position, exhale up and out of position. And the final position for this video is going to be the eyebrows, the forehead area. When we are full of cold, we can get congested in this area. So we're going to be placing the block or the towel on the eyebrows so you can have it anywhere along here where the pain is for you. And you can do this seated, placing the block or towel in your hand, placing your elbows on a surface and just leaning into that block or towel, or we can do this lying down. So I'll just show you with the towel. So you just hold onto the towel, lean onto a surface and add that pressure, and as your body weight sinks in, and you will then connect to that pain and then keep breathing in that diaphragmatic way that we've done throughout the whole of the positions. So on the lying down in a bed on the floor, slowly come down to the mat and then hold on to the block or the towel, and you want to place your head, lift your eyebrows and then connect into this area. So connect to the breath. Again, breathing in through the nose for that count of 4. Breathing out through the nose for that count of 6. Feeling yourself sinking into the area. And then you can start to make some movements. And you do this very slowly just by moving your head one way and then the other. And we just want to make very small movements, finding when the next area of pain is, staying there for a few breaths and then moving on to the next area. And you can stay in this position for as long as feels good for you, but a minimum of 3 minutes. And you may need a tissue when doing this position, because when we're getting rid of all those congestions, it can make your nose start to run as well. And when you finish, just exhale up and out of position. So they have 4 positions that you can use when you're not feeling great, lack of energy, having that cold or cough, to open up the chest, relax the face and get that breath breathing to support the body. If you enjoyed this video today, there's a link in my description of my online classes. In these online classes, we cover the whole of the body. We focus on certain areas, we breathe diaphragmatically into those areas and we melt away the pain. We increase the blood and oxygen into the body so that we could decompress the fascia, create space in the body, and then we maintain that space with correct posture. Thank you for joining me today, and I look forward to seeing you in class soon.